All right, my friend, let's talk a little about this flu bug that's been going around for a while. Pediatrician Dr. Andrea Goins is with us today. Dr. Goins is the medical director of Children's Urgent Care Center at Children's Hospital here in Chattanooga. How are you?
I'm good.
Is this the biggest ever flu bug, or is there always one lingering out there?
The biggest in a long time. We've seen more cases this year than we have in quite a while.
Does that necessarily mean it's bad? Or real bad,
It's not necessarily real bad. We're just seeing a lot more of it this year than we have in the past.
All right. When should a parent decide that they need to go to their pediatrician or to the ER?
So basically, if you think your child is getting worse, so there's the flu in and of itself is a virus that the child can get rid of on their own. Their body will fight on their own. But if they're not drinking well, becoming more fussy or irritable, or if they start to get better and then get worse again, they need to go in and be seen. They could be having a complication from the flu.
What kind of complications?
Common things that we see are pneumonia after the flu, ear infections, typical things, but some of the more serious things, including some brain complications, can be seen. So if you're at all uncertain, have your pediatrician or Children's Hospital take a look.
Is there anything you can do as a mom or dad at home with the kids?
The best thing to do is lots of rest, lots of fluids, and then Tylenol and ibuprofen or acetaminophen and ibuprofen as age appropriate.
Yeah. Oh shoot, I lost my place there. But one good thing is, does chicken soup really help?
Not really. It just makes you feel better. And
make you feel better.
Tastes good.
Well, that's good. For sure. Are the ERs doing lots of things? I mean, are they super busy with particularly, I would think, maybe children late afternoon, early evenings?
And I do the after-hours urgent clinic, and we are open from 6 p.m. till midnight every night, 7 days a week. And those are for the patients that can't get in to see their doctor during the day, or whose child gets sick when their doctor's office isn't open, and needs to be seen for a non-emergent condition that doesn't need necessarily emergency department care, but want to be seen by a doctor.
Now, can you still give children flu shots?
You can. We still have some available within the county.
Yeah, and it's okay to go ahead and...
It is, and I would recommend that anyone that hasn't had one needs to get one.
Yeah, and because there's so many of them that say, oh, every time I take a flu shot, I get the flu.
That's true. There's a lot of people that say that. There's no medical science behind that. If anything, you're probably exposed to lots of other things in the waiting rooms of these doctors' offices or pharmacies that are giving the flu shot, but for the most part.
But it does help to wash your hands very frequently,
Absolutely.
I'm sure.
Lots of hand washing. Avoid contact with known people that are sick, anybody that you know is sick. And then those... children and even adults with chronic medical conditions need to be especially careful and avoid lots of public places where we're seeing the flu.
All right. Now about the care again, that center's open from what till? The
urgent care clinic is open from 6 p.m. till midnight, 7 days a week.
7 days a week. That is good news. And we've got, if you need them, they're there.
We're there.
The good part. Thank you. Imagine a recipe that is as fitting as breakfast or an afternoon snack.